events have shown Malta's ability to serve as a haven to thousands of people seeking refuge. The island's geographical position in the Mediterranean has made it a common port of arrival for thousands of migrants who, for these past few years, have set sail from the coast of North Africa towards Europe in search of protection.
You have people who are fleeing from their countries. They're fleeing because of persecution, they're fleeing because of war, they're fleeing because of violence, and they're basically exercising their right to seek asylum. There is an international refugee law framework that gives them that right.
It is common knowledge that Malta detains every undocumented person and asylum seeker reaching its shores.
Recently there were some changes in this process, and they now go initially to a reception centre where they're also their immediate health needs are assessed, and then afterwards they're placed in the detention centre. This recent development is obviously a positive thing, but we are very concerned still about the conditions within detention. Over the last couple of years, as a result of the drop in arrivals, obviously there hasn't been the problems that there were in the past, but in the past there were serious concerns vis-à-vis overcrowding, which had serious impacts on the health of migrants, and access to medical care, access to treatment, not just for physical treatment, but also in terms of mental illness and psychosocial care as well.
A survey was conducted in Malta in 2010 towards 100 asylum seekers and undocumented migrants. The survey focused on the living conditions and the access to healthcare of migrants living outside of detention centres. When asked about their living conditions, 85% of the respondents claimed to have encountered problems in their accommodation that could be pathogenic, including overcrowding, lack of access to basic amenities such as toilets, washroom or running water, unsanitary and dangerous conditions such as degraded accommodation or faulty electricity installation.
If you look at open centres, we see a group of people who are actually living together. So we have to actually cater for this group of people, and the most important thing is that in respect of healthcare, that they would have accessible healthcare. This is very important so that any condition which they have, they will be able to access our healthcare system.
The starting point is that there is actually a good legal framework in Malta that allows and ensures access to public health services. So that's the fundament. Now, there are practical issues when it comes to accessing that right.
One limitation which we are trying to cater for as much as we can is the difference in both the language and the culture of people who are coming from countries which have different languages and different cultures from us. So basically, with help of cultural mediators, we are working so that we will be able to cater for their needs in respect of healthcare system.
Another thing is information. How does, for instance, the pharmacy system in Malta work? How does the public hospital system work if you need an operation? Sometimes we have people coming to our office asking about problems they're facing that might not be about obstacles to healthcare, but it's simply a matter of understanding how the system works and understanding how to best access available services.
Since the arrival of asylum seekers in Malta has decreased in recent months, there are very few people left in detention centres, and the majority of people now live in open centres or in the community.
We know that many are still, of course, living, as you say, in the centres, more than 2,000 at the moment. That means that conditions are quite crowded. Even though there are basic services available, we also know that many of them are living in conditions that are not conducive to long-term development of a livelihood and of a proper way to live.
The open centres accommodate a sizable amount of people, living in conditions that could easily expose them to health-related issues.
There seems to be a disparity, if you like, between policy, which is very, very unclear, and practice. In terms of the only policy document that we have, which was issued in 2005, it's a little unclear as to who can qualify for what vis-à-vis a person's status. Our biggest concerns are not so much those who have refugee status, but asylum seekers that have been granted subsidiary protection and those that have been rejected.
If you look at the transfer from migrants who are living from closed centres into open centres, there are a number of issues. First of all, we are very careful for any diseases of infectious disease origin. In closed centres, we are concerned about any overcrowding which there could be. We are also very careful about childhood vaccine-preventable diseases in children, because some of these children who come from migrant areas may have not been vaccinated with all the vaccines which are required for children. So as soon as they arrive in Malta, we offer free vaccination to these children and also offer vaccination to adults according to the childhood vaccination schedule we have in Malta. Like this, we will be able to prevent certain infectious diseases which can be preventable by vaccines.
70% of the people interviewed in the 2010 survey faced difficulties when they tried to access healthcare in Malta. Médecins du Monde, France, initiated the HUMA Networks to advocate for an effective access to healthcare and prevention for undocumented migrants. These should be treated on equal grounds as nationals with the same level of resources. HUMA also advocates for the needs of vulnerable groups of migrants, such as pregnant women, children and victims of torture, to be addressed.
We also know that many of the people coming have gone through great traumas, both where they came from and also in order to get here. Now, those traumas often lead to difficult health problems, mental health, but also physical conditions that may need very specific follow-up. It needs individual and consistent follow-up. That follow-up is not always available for people who need it, not at the capacity that we would like to see. We know, of course, also that for Maltese people in Malta, the issue of access and immediate access to health services is an issue. So we're not saying this is something that only affects migrants and refugees, but it is an area that we're very much looking at how could one improve the efficiency of access to health services.
In the survey, 1/4 of the migrants interviewed felt in a bad or very bad state of general health, despite the fact that the population was young. This is a high proportion compared to the rest of the Maltese population. 70% perceive bad or very bad state of psychological health.
I think an area which is worth mentioning is also mental health. There are mental health support services in Malta, and they are doing a very good job. However, given the trauma of many of the people who have arrived, remember many of them are coming, for instance, for Somalia, having gone through years of a very difficult situation, having lost family members, exposed to very violent situations, etc.
Mental health problems are a serious concern, not least because of the conditions under which forced migrants leave the country of origin, the nature of the passage through sub-Saharan Africa, crossing the Mediterranean, then again in the detention centres, and of course upon arrival and in the open centres and in the wider community as well.
The current legislation gives the right to access health services in Malta to everyone who needs it. One legal provision entitles the asylum seekers to access free of charge state medical care and services. Now, due to the unclear specifications of the law, there is no legal provision on access to healthcare for undocumented migrants, other than a non-legally binding policy document establishing that all foreigners in detention are entitled to free state medical care and services.
Access to healthcare is a human right, of course, but we still don't know exactly who qualifies for what, and this is worrying. Now, on the one hand, it would be fair to say that a number of people have received excellent care in the hospital, and once they reach hospital because they need emergency care, this is being provided. On the other hand, there are also clear examples of persons that did not get appointments when they needed them, were turned away or faced obstacles in accessing healthcare, and also, of course, in terms of being able to afford treatment as well, antibiotics, for example, and different medicines.
The legal framework allows for people to access health services, and we see that people do access health services, and we've also seen improvements in recent years where hospitals and so on are facilitating so that people who come have a possibility to communicate what health needs they have.
Since things are unclear, This opens a wide variety of interpretations that usually allow for the discretionary practices of medical professionals when approached for assistance. In the survey, 26% of the migrants interviewed who had tried to access healthcare had been refused access by the administration of healthcare facilities or health professionals. Close to 1 person in 3 felt discriminated against in healthcare facilities.
Well, there needs to be more clarity in terms of who has a right to what. A couple of years ago, there was recommendations put forward for a migrant health policy that, to my knowledge, nothing has been done in this regard. We would like to see more commitment in terms of political commitment, if you like, and more clarity in terms of who can receive what care. And we would like to see that all migrants, regardless of status, can be assured of free medical care as and when they need it. One of the negative elements of this is that if a person can only be sure of emergency care, then the chances are that they will not access the healthcare system until it is very, very late on in the day. And this obviously has serious ramifications for the individual's health and also impacts the Maltese health system as well. So it has ramifications for the broader Maltese society.
To claim for making medical care as accessible as possible to these people, a European Declaration of Health Professionals was drafted towards a non-discriminatory access to healthcare regardless of status. NGOs recommend that it's important to improve the open centres facilities now. Improving the living conditions in these centres may contribute to later healthcare expenditure. Professional psychological care should also be provided to all migrants who have endured hardships.
That kind of a situation might require very sustained individual follow-up in terms of mental health support. And it's an area where we see there is a gap, and both the government and NGOs and others, I think, need to work together to fill that gap even further than what is happening now.
Better information on healthcare entitlements should be delivered to both migrants and medical professionals.
And we would also like to see more training and more awareness of migrant health needs, particularly the sub-Saharan African migrant population. There have been some positive step forwards. For example, in the last year, primary healthcare is employing cultural mediators, and they're also employed in the hospital. This is a great step forward, but there's a lot more work that still needs to be done.
This awareness will not only improve the accessibility to the Maltese healthcare system, but also reduces discriminatory practices.
In fact, I don't think the biggest problem is the rules and the laws when we're talking about the health services in Malta. In fact, the regulations in Malta ensures access to basic health services for all refugees and various groups of migrants who arrive here. I think the problem is more when it comes to the capacity of those who are providing those services, perhaps also on the expertise that needs to be there to deal with those specific issues that affect migrants and refugees.
The European Declaration should be signed by local medical staff as proof of their commitment towards a non-discriminatory access to healthcare for all. All this would be an important step towards the improvement of migrants' access to healthcare in Malta.